Good morning, everybody, and welcome to Thrive, Not Just Survive. Today is Thursday. I actually know what day it is today because I might be wrong. See, I am getting my days mixed up. It is Wednesday. The reason I thought it was Thursday is because my son and I had a conversation. He is really looking at his schedule and the Zoom calls that he does. So Thursdays are his Zoom calls with his group of people that he associates himself with. So anyways, happy Wednesday. I hope you guys are all doing well. The guest I have on today is going to be talking about a very I want to say special kind of therapy that you may or may not have heard about. And we're talking about craniosacral therapy. Now, I've known Sajida for many, many years and, watched her do different things, but really intrigued when she talked to me about this particular type of therapy. So I do want to bring her on because I want her to guide us through. I believe this session will be helpful to so many people on so many different levels that I think that, without us going into too much small talk, we should just get right into it so she can share with us not only her journey, but about the benefits of this type of therapy. So let me bring her on so that we can start this conversation. Hey, Sajida, welcome. And I thank you so much for taking the time today to come and talk about something that really interested me when I found out about it through you. So first of all, tell us a little bit about who you are and your journey of sort of how you got to what you're doing now.
Hi, Nasira. I am Sajida Habib. I am the mother of three boys. Um, Actually love doing what I do. I love treating people with craniosacral therapy. I'm a registered massage therapist. I've had a long journey getting to it. Um, my grandmother back in Uganda used to treat people for backaches, kids with compression in the neck. It's her family gift. People would just come to her. Her nephew is quite well known for it, but he is now in Uganda. And I really think it's a gift that I got from my maternal grandmother. Okay, so my journey to it. I had an accident um, 22 years ago. And my sister, who's a physiotherapist, kept telling me to go for craniosacral therapy. And I was like, yeah, okay. But after the accident, I did go for craniosacral therapy to craniosacral therapy downtown. And it had such an impact on me. I used to get migraines on and off. I had constant low backache. Um, I had a pressure point between my shoulder blade on the left hand side. There was anytime I got stressed, it would start throbbing internally, and it would just stay present. You could massage it, put whatever, but it would not go. So I went to Alex, and she um, it's a very gentle treatment. You just have to trust. Uh, they have different hand placements, very, very gentle. And I went once a week for 10 weeks. Now, technically, after an accident, I had a pretty bad accident. A lady ran the red light and hit me so hard, my car hit the traffic lights and basically stopped. And normally it can take you literally a year to recover. Uh, Physiotherapies are good, so are chiropractors. But I literally just went 10 times to Alex, and I didn't like forget the impact of the car, just my chronic stuff that was happening. It was not so bad. I was young, so I would just, move ahead. But but basically, my pain in my shoulder blade left. My migraines disappeared. My headaches disappeared. My low back pain disappeared. To the point I took all my care. My third son was born after, but I took my older son, Kumail Kazim. My husband started coming along, and it was a perfect time because just before I think about 6 months before that, my eldest started getting real horrible stomach aches and a headache, and I realized after they're called tummy migraines. And by fluke, I was watching something on NBC, and or 60 minutes, and there's this whole thing about tummy migraines and how you have to be on very strong medication for it. But when I took him to Alex and Robert, it's a very well set up practice. They disappeared. And what we realized is I have to be proactive anytime the pressure changed. So at the fall time before snow came, or when the snow melted, he would have these, and he would stay in my, like, I remember sitting with him for hours, and he would be really bent over in pain. So
Wow.
yeah, so that's when I started taking it as a parent from Robert, his classes, and I just fell in love with it, and I just started treating people, um, and it really became my passion.
So tell me a little bit more about what it like. It sounds a little bit, because you said that there you use your hands and
Yeah.
placement of hands. Is it similar to Reiki?
No, Reiki is off the body. You have to place your hands. It has specific placement, like craniosacral. So cranium is the head, sacrum is the sacrum, the just above the tailbone, the lowest part of our spine. And so you're really working between the two places. Because
Okay.
imagine our dura from the brain is in that, in the spinal cord, in the between the vertebrae, this our spine, and it also works with our bones in our head. So initial thought was, many, I don't know how many years ago, that the bones were fused. So we have the frontal bone, the parietal bone. So, but they realize that they're not fused. There's gentle movement in them, because the cerebrospinal fluid is made in the brain. It goes into the dural tube and back into the brain. So if it was stuck, imagine if you had a stuck a ball and there was fluid in there, but there has to be movement in them. So
Right.
what I would start to do is I'd put my hand on your sacrum, or first of all on your feet, to feel the rhythm. So because it when it fills, it goes, it basically it goes in this direction. So you can feel it anywhere on your body. You put your
Mm,
hand on your thighs, on your feet, and I can feel the movement, and I can immediately tell where the restriction is.
okay.
So it works with the spine and the head. It also works. It The best way to describe craniosacral therapy is it releases fascial restrictions anywhere in the body. So fascial restrictions happen if you're dehydrated, or if you're overusing a muscle, if you're doing the same thing over and over again, sitting on the computer, constantly sitting like this. You've got fascial restriction in your chest area. Your
Mm,
back becomes overstretched, or you're not using it enough, or there's stress, um, or there's disease, surgeries. So all of that. For instance, say I've had I hurt myself, and I cut myself here, and I have surgery. There were stitches taken, right? So fascia is like a stocking. Imagine a stocking that you put on your whole body, on your whole leg, right? And you can see the fibers. What you'll see is, if I put a pin over here, all the fibers will be going towards this area, right? So right from my toe up. So the most I might start hurting in my toe, and I'm like, okay, why is my toe hurting? Or maybe for the chest, a lot of times you'll feel more pressure in the center, and it's okay, am I getting a heart attack? A lot of times, oh, muscle tension. But really, if I release this area, everything goes back to its place.
wow.
Okay.
So then explain. So like you said, like you're feeling the movement, right? Like if you start, let's say at the feet. Now I've had a session with you, so I have a little
Yeah.
bit more knowledge, but I want to talk to it in a way that others may not have even heard of this type of therapy. So I want to kind of make sure they understand. So when you do this, where you can feel this movement, what are you
Hmm.
doing? Like, are you making it so that the fact that you're touching their feet or whatever, allowing more of the movement energetically, or it like
So it you can say it is energetically, but actually, what I would do is I'd put my hand on your feet, and I could almost tell which side is a little bit more stuck or where there's fascial restrictions. So is it
Okay.
your right side or your left side, right? Many of us, I treat people who do a lot of work standing sometimes. If I'm treating somebody who is a teller at a bank teller who's standing all the time. Many of us put our weight on the right side automatically without subconscious thinking. So the right side could be a little bit tighter because it's just tired of holding the position for so long. So I could feel where the right side is, and I could almost feel the direction of the fascial energy taking me in there, and I would more than likely treat the right hip.
Okay.
Okay. And you just put there's two ways of doing it. When you're more experienced, you just sit, put your hands on the body, and it'll tell you where to go. So
Wow.
the person who is receiving it has to be open to it, even
Right.
subconsciously. I've had bodies who I've treated. I work at a rehab and many years ago. But then after my CRANIOSACRAL therapy, I did my registered massage therapy because I thought, okay, to help people both ways. So I fell in love with both therapies. So I'm normally people will either have just a CRANIOSACRAL therapy, which is just hands-on, like very gentle touch, or they'll have massage therapy. So sometimes there'll be RMTs. There's a lot of physios who do it. You choose one or the other with an RMT, but I feel both have benefit.
Right.
So I would treat a body, to me, it's a body on the table, and I can feel the um whether I can work with your critical therapy, critically or
Right.
not. So
Right.
you have to be open to it,
Right.
right?
Right. And that's
So
with any kind of treatment anyways, right? The patient
absolutely.
has to be, don't want to call him patient, but the person has to be open to, even if it is a medication they're taking, they have to
Yes,
be open to the idea that this will work for it to
yes.
work, right?
And
So
it's really it's very subconscious. You may not even be aware of it. So when I'm treating you and an area is calling to me, now this might sound this is crazy, but it's not. It is again, I'd put my hand in that area, and a lot of, especially people who have had motor vehicle accidents, low
Mm,
backs are really bad. The left side because we are strapped on the left side with our seatbelt. So you just go there and you just treat literally for you know just to see if they're engaging, their tissue is engaging with me. I would treat it for about good 2-3 minutes, and I would do the massage, and they're like, oh, that felt really good. The main purpose of craniosacral therapy is to reducing. The other one is to reduce the sympathetic nervous system, so the flight and fright response. So when you're anxious, people who have anxiety or have panic attacks, migraines, headaches. Um, it really works well with it. I remember when I had first learned it as a parent for the benefit of my kids. Um, I had a friend. I was working as a preschool a facilitator, and I remember one of my very good friends said, I'm having panic attacks. I can't sleep, and I said, sure, you just come to me, and I just treated her, and just within 2 or 3 treatments. And remember, I was just learning it as a parent. I had my hands on. I am very intuitive to start off with. And she left me a message and said, Sajida, when I wake up in the night, I go back to sleep. I don't have the panic attacks anymore.
wow.
So that's how powerful this is. And the reason I'm talking about my MVA, my motor vehicle accident, uh, would take at least the way I was hit hard, and depends how healthy I was at that time, my age, my restrictions, and all right. But would have taken at least 6 months, if not longer, twice a week visits to the physio or the chiropractor. And not that they're wrong; they're good, but this is. And I guess Alex was such an experienced therapist that within 10 treatments, I was done.
Right. And I guess that's the other thing, right? I mean, there's a lot of history in depending when they come to that place of needing that therapy. Like if you're young, you have whatever
Yes,
your body is
absolutely.
more pliable, whereas when you're at, maybe
Absolutely.
older age, there's other things also that have caused trauma or things have gone on and more restrictions are there. So of course it'll vary, but I guess the other thing, and I just want to mention, because you mentioned it, is that Alex was such a master at that
Yes.
type of therapy that you want to go to somebody who's had experience and understands, right, how that therapy works and how you
Hmm.
can tailor it to the person who's there on your table to make sure that
Absolutely.
it's befitting their needs, right? It's helping them with their issue because everybody has different things they may be going through.
Absolutely. Um, One other aspect, as you become more advanced in craniosacral therapy, there's something called, I think it's become a very big word these days, is cell memory, right? Like it's very well known that our cells have memory. So it is called SER, somato emotional releases. So,
Okay.
so that is really big with craniosacral therapy too. Like you've got the typical hand placement, like the 10-step protocol, as we call it. When you come in, you would get assessed by the 10-step protocol. Um, but it helps with everything because when you're working with the skull, you're working with the brain, right? Because there's our tentorium, the skull, the the fascia just under the skull. Any type of hits as a child that you could have gotten hit, yeah, any type of like it's become very, very big with football players.
Mm,
The Football Association of like the American football, I don't even know, not the AFL, I can't even, I don't watch football, but they have felt such a huge impact through craniosacral therapy that they've actually formed they have uh, programs where they fundraise for the Upledger Institute
mm,
because they have programs where there'll be one person on the table with four people, like four therapists with their hands on them, and they work on their fascia, and they have such releases. I don't know if you watched. There's something called Concussion. There's a movie called Concussion.
yes.
It is a very powerful movie that shows the constant hit on the heads. My son was playing ultimate frisbee, my youngest, and to me it's like, oh, he's just playing frisbee. What's the big deal? But he actually got a horrible concussion. And when my husband took him to the emerge, they're like, oh yeah, you must have been playing ultimate frisbee because it's a really somebody's shoulder hit him in the jaw
Mm,
really hard. So can you imagine your brain gets jarred? And we were told that for 2 weeks he may not be able to go to school.
wow.
So when he came home, I literally sat at his head for an hour and a half in the mornings, an hour and a half in the evenings, and he was able to return within 5 days back to school.
Wow.
So that's how powerful.
So then that brings me to, I know you were talking about sessions, but how long would a session last for a client that you've got that is doing this type of therapy?
It depends because, again, he's young. Hopefully, he has less trauma, even
Mhm.
not just physical trauma, even emotional trauma. Because when I'm talking about stress, disease, to me, disease is, again, it's a very strong belief that I personally have, is everything starts with unresolved issues in the body or the emotions. That's where cell trauma comes in, cell memory comes in. So it depends. um, if maybe a person who's even 50 who's just has had very little trauma in their life and maybe a very how do I put it, a forgiving person to their emotional trauma, they may take 6 to 8, who knows, like five. Each body is so different, Nasira, that there is no set. I've
Right.
been going for so many years, and there's still times when my low back will give out. There's also visceral part of it, which is dealing with the organs, because there can be restrictions within your organs that need to be released. So it could be 5, it could be 10. What I did find is when I went to Alex, so after those 10 sessions, my kids went, so they would go, we'd go once every week or once every 2 weeks for the first month or so. So after 4 or 5, and then you almost go like a tune-up.
Mm,
So you'd go for my oldest, because he had these stomach migraines and it was due to the pressure outside, we would go just before spring started and just before snow fell,
right. So
right?
it
So
just
before
depends on what,
snowfall.
Yes, yes. And so you have to be aware kind of maybe even your triggers. There might be some triggers that maybe
Yeah,
bring on certain
yes,
whatever tensions or stress, right?
absolutely.
Yeah, so I think, I mean, it's an interesting type of therapy. I don't know if I understand that, you're, I guess, working with fascia, you're saying, right? In terms of the cranial and the sacral. So,
Yeah.
right? Is that right? Am
So,
I
and also what we do is, for instance, with a headache, typically the base of our skull, God has given us innate stuff. Like, how many times do you just sit like this? Right? When you want to relax, you're like this. You're
right,
actually giving yourself the occiput release. So the occiput bone is here and the temporal is here. So when you're doing this and you feel so relaxed, you're giving yourself still points, which is like it's amazing what we have got innate ways of healing ourselves. So, as Upledger said, that nobody heals. It's really the patient. He was a physician, a doctor of osteopathy, and he said, you release yourself. So, the body has the ability to release itself.
right, right,
So you work with the cradle bone. So if I find that there's a tightness in my parietal bone, the temporal bone is here near our ear. So when you have vertigo or you got a a really bad sinus headache, so you work with all of these bones to release them. So to put the movement back. So if I have movement here and my this side is stuck, okay. So can you imagine the
right,
brain is underneath all that?
right,
So this side. So sometimes it was so interesting when Robert would treat my oldest. He would say, uh, he would release him and he'd say, how has your math been? And my son would say, a little off these days. And the computation, depending which part of your frontal brain or the parietal or the temporal, so all of that has such huge impact in learning in anything. Birthing can give you a sacral compression, which is our sacrum, our tailbone area. And because remember, it's the sacrum, the lumbar, the thoracic, so they all go up right to our brain. So whatever happens at the base of our spine is happening at the top of our spine. So
right,
jaw is very big. You do intraoral work. Some people have a hard time maybe expressing themselves, and that could be because of restriction in their neck or in their jaw.
right.
And
Isn't
I'm
that
not
interesting?
yeah, and it's not just physical.
Right.
It's even the concern of am I going to like the emotional aspect of it is also released. So
Right.
it's
But I like
really
the fact that you said even about learning, like
yes,
somebody like math or whatever, if there's some sort of computation miscommunication or misfiring,
yeah,
it's
yeah,
like you're getting to a point where even that is a release. Like you're
absolutely,
that is very interesting.
absolutely.
I didn't know that.
Oh, it is. It is. Like there's specializations with kids. So there's people with autistic. Autism has had an impact by releasing the parietal bone because the thought is that it is so stuck down that the pressure is very very upsetting. ADD, ADHD, all of that has had an impact by craniosacral therapy.
And I guess so this is something that when somebody's looking at different therapies and when they maybe want to either not take as many drugs or of course some of
Yes,
these illnesses require some form of medical
absolutely.
intervention, but it's just another addition to the care that may alleviate some of the symptoms and help that person flourish or have a better life experience just from the added therapy that could help them.
Absolutely. No
Yeah.
question about it.
So there's no age, like in the sense of, certain age where it could be a child, it could be an older person.
A baby. So the earliest age you can treat, frankly, is right after birthing. Because the child has gone through trauma. Imagine going through the narrow canal and coming out, right? Or if you've had a C-section, your child has not had the benefit of of slowly being pressurized and then coming out into this world. Remember, there's pressure everywhere, right? It's just been pulled out into the world. The
Right.
forceps. So the earliest benefit is really starting off as a baby. and
Wow.
it's very gentle. Colic, big thing with colic.
So
So
that's
you,
really, like, I find that so interesting because moms that are having babies, and then especially brand new moms, first
yes,
baby, right?
yes,
There's so much stress for themselves. There's a hormonal change going on, and then they may
absolutely.
have a baby that has these extra needs, because I know my son did extreme colic,
Exactly.
right?
Yes,
Yeah.
yes.
So knowing that there could be a therapy or a way to get that baby to settle a bit more
Mhm.
without drug intervention or anything else that you want to give your baby, especially, when you're a new mom, you're very cognizant of what you're putting into the baby. I think
Yes.
it's a great thing to even understand that there are options out there.
Oh, it is amazing. I wish I had known with my firstborn. Again, he really suffered with colic. But so what I do is one thing I would suggest is when you want to go for specific therapies, look up, like you put up upleisure.com. That's the main website, and they would have the therapist online. So I mean, they've got the therapist on their website where you could find a therapist. And then
Right,
what you want to look is at their training because they're like, and some people just have really are able to do it like this.
right,
And some people may have, for instance, um, I've done the first course with the babies, and then I moved on to visceral therapy, which is organ therapy, and the brain therapy because I've had a stroke many years ago, and um, and I just find that maybe there's something within me that's
right.
not comfortable that something is calling me, either since I was a child that I feel like if you've got colic, I'll send you to somebody. So a really good therapist will send you, especially with a new mom, I cannot imagine, would just send you to who I know work amazing with babies.
And that's the thing, right? It's like you want to refer somebody, it's like going to a specialist, right? You're not going
Yeah,
to go to a GP if you're looking for a surgeon, right? Like,
yeah,
depending on
yeah,
what the needs are. So it's like
yeah,
referring the person to the right person who has the mastery of that particular,
absolutely,
right? The babies or the adolescents or whatever that might be. I think the
absolutely,
key is to find the therapy that works, the therapist that works for
yes,
the concern that we were trying to deal with, and their
yeah,
expertise and
yeah.
experience. Because at the end of the day, that's what's going to produce a result.
Absolutely. So really, the only time that it's a contraindication is if you've got oh, I even deal with people who've got chronic diseases or who've had cancer. So it really makes your system so much calmer. But the only is if you've got a brain bleed. So you wouldn't work in the brain just for the first few days after a stroke. The first little bit you don't. But then I went after my stroke. I went quite a bit to Alex. Um, but yeah, so you really they've gone so far into they've even gone into they call it the second brain, the enteric system, which is the stomach area, because these days I guess it may always have been, but you hear so much about IBS,
Yes.
irritable bowel syndrome. It's really speaking, it's the stressors
Mm,
of life
right.
that is really getting us all ill.
So let me ask you another question. I know we didn't discuss this, but it's just coming to me. So does this help with your immune system? Like, now that we're at COVID-19 and everybody's kind of looking at how do you up or boost our immune systems so that we can, even if we get it, that we're able to fight it off better, and just in general have better health. Would this be something that would help boost the immune system?
Yeah, there's a special course called CSR and Immune. So
Wow.
people, so really, I have done the brain work where it's called touching the brain. Now people will be like, this is crazy, but you're not really touching the brain. But when somebody put their hand on my head during, so it's like you take uh, the notes and stuff, and then you do the practical sessions, and they immediately fled that, okay, something is off on your left side. And I've had my stroke was on my left side, 'cause it affected my right side, my left brain. So it is amazing what you can pick up. And then you'll actually work on they'll go deeper into the brain without obviously touching it. But it
Right.
has amazing effects. So yes, immune is very good. Um, it actually brings everything back into function. So for better functionality of your whole body, um, your the thing behind critical therapy and osteopathy is that you're a whole being. So it's not just the physical symptoms you're treating. You're also treating like your whole function. So physical, emotional, it really all works really well together.
Right. And so now that we're in COVID-19, and there's, of course, this whole idea of not being, in somebody's
Close.
physical presence, is this a type of therapy that can be done remotely, or is this one that definitely needs
Well,
the touch?
typically it is hands-on. But I know that I just took a course, a full 5-day course, about 3 weeks ago, where I can. It's an energy. It's offered by a critical therapy teacher. It's Suzanne Skerlock Durana, and what she taught is you actually, if I was to do it with you, you'd feel my energy coming in. So,
Hmm.
but critical therapy typically is a hands-on therapy, but you can, I wouldn't call it critical therapy, but if I could put my hands on you and we treat each other, and most people, not most, I think 50% were critical therapists and the others were energy workers. But so I could do the dural traction, I could do the occiput release, the release, so you could feel it. But typically it's only hands-on.
Okay. So that's really interesting because I think, obviously we're going to get through COVID-19. We're going to get past
Yeah.
this. And so it's good for people to, two things. One, know what cranial sacral therapy is, because first of all, when I met you and you said that word, I was like, what is that? Right. So one is to, okay, understand what it is. And then the next thing is to be aware that there are other therapies out there that perhaps, one can look into.
Absolutely.
Just because it's an awareness thing. I think as we become more aware, as the human race
Hmm.
evolves into this other type of learning,
Hmm.
there's so many options. There's different options, and it's what you
Absolutely.
resonate with, right?
Absolutely. And the one thing that is about critical therapy that is some people do not like to have their, like for massages, you would take your clothes off, you're covered, you use oils and stuff. This is with clothes on. So I
Okay.
can just be sitting like this. I can put a mask on my face, and the other person can put the mask on my face, have gloves on. And so it is much, I find, safer. Yes, you don't have to come close to the mouth,
Right.
but I feel it's because, as you're right, with COVID-19, I think things are really going to change.
Yes. Yes. I
Like,
absolutely think
especially
that.
manual therapies will
Yes.
be, yeah.
Yeah, and I think that's another awakening. I look at all of this, honestly, as I've started this broadcast about 60 days ago, and I've said there's a blessing in this. Something is telling me that there's a reset going on. We are on a
Yeah.
pause button, but it's because things needed to be shifted. Our other normal
Mm.
wasn't working, and a new normal is being created. So as we move forward, things that we were used to are going to look different. We're going to do things differently, whether it's going to the doctor, whether it's going on the bus, to wherever we're going, or working. It's going to
Yeah,
look different.
absolutely.
Yeah.
Absolutely.
And I think there's a benefit
Yeah.
in all of it, right? So we're learning about, the idea
Mhm.
of a mask, not just for COVID-19, but if you're just not well, we have to be
Yeah.
cognizant of how we are affecting others, right? If we
Yeah.
have a common cold, let's say, we were all just like, oh, just go to work, no problem,
Yeah.
right? But we're
Yeah.
becoming more aware of how that's affecting others and how our behaviors does matter, in terms of our community.
Absolutely. I mean, 30 years ago, when I used to work in an office environment, if you had a cold, you could take 3 days off. No, you would not come in. There was no question about it.
Right.
But now taking a day off with a common cold, like, what's wrong with you? So, absolutely. I think we were trying to function as superhuman beings, and it's really affected the whole entire, I feel, our world environment.
Yeah, our
So,
existence. Yeah, definitely. And I think that's why, like, I look at this as a blessing that yes, it's a reset. We're all kind of figuring things out of how we're going to do it after COVID-19. Who are we going to become
yeah,
in the process, right? Who are
yeah,
we anyways? Like, I think the bigger question is, well, who are we now, and who are we becoming? Who are we impacting? How are we doing things that are different, and the missions that we are trying
yeah,
to accomplish, right? So I think this
yeah.
is a beautiful journey. And you know what? I can talk to you for hours, and you know that, and we have talked for
Yeah.
hours. But I just want to thank you. I know, I've taken up this morning from you, but I think the audience
Thank you.
will even if you're watching this on replay, guys, just make sure that you take in this information and learn about it. Go to upledger.com. There's lots of information there. If you want to, reach out to Sajida, find her on Facebook. You can send her a friend request. You're okay with that, right, Sajida?
Absolutely, I'm fine. Yep.
Ask questions, because the idea here is to help each other, educate each other, and you never know, something someone might say might be that saving grace for somebody else. So, I want to thank you for your time. I really encourage people to reach out if they have questions for you. So I'm going to end the program with just thanking everybody that's joined in. If you are watching this either live or replay, share the video. You never know who this can help. And the other thing I encourage you to do is create a space for yourself to be open-minded and allow yourself to find the information. Trust me when I say this, that when you make the intention of looking for something or finding something, you guys all know that I believe and I teach the law of attraction and thought harvesting and how that affects your experience. Once you put that out there, the things will appear in your experience so that you can look into it. So it's like they say, the teacher appears when the student is ready. So be open to it and allow this time while you're home with COVID and trying to figure things out. Allow that learning to take place for you. So I want to thank you for joining me. I know this was one of our longer sessions, but I trust that it will help you. Reach out to me if you have any questions. Reach out to Sajida. She's an amazing person. She is always willing to help. So happy Wednesday. I will see you tomorrow. I do have another guest on tomorrow that is actually one of our regular guests, Sharon Fillmore. We're going to be talking about some amazing things that will help you, again, with your learning process. So join me tomorrow, Thursday, 10 a.m. I will see you there, and I wish you a happy day. Be kind to yourselves and to each other. I love you all.